All right. Good afternoon, everybody. We're here for a COVID-19 update. I am joined today by our Health Commissioner, Dr. DeRosa, Ed Laverne, CEO of Ascension St. Agnes Hospital, our Police Commissioner Harrison, and Fire Chief Ford. Thank you all for being here today. We will start off with our COVID-19 numbers. The following numbers are based on the data most recently available to us from yesterday. As of yesterday, we had 39,820 cases of COVID-19. That is a 60% decrease from 1 month ago. Our positivity rate in the city is down 58% from 1 month ago. There are 280 people hospitalized in Baltimore because of COVID. 83% of our ICU beds and 83% of our acute care beds are currently utilized, which is also a decrease. And we have now lost, unfortunately, 782 Baltimoreans from COVID-19. Of course, our updated COVID-19 mandates took effect at 6 a.m. today. As a reminder, you can always see the executive order for all of our details online at baltimorecity.gov and click mayoral executive orders. We will also continue to share details and updates on social media. Even as we take responsible steps towards reopening, we are urging everyone, again, to stay vigilant and remind themselves and everyone that they know that this pandemic is real and taking people away from us. Baltimore will continue to make decisions in collaboration with our health experts, hospital partners, and the public health data as we have throughout this pandemic. We remain confident and cautiously optimistic as our numbers continue to trend in the right direction. We have all of us have put forth a huge effort in ensuring that our residents are protected and cared for as we continue to weather this pandemic together. A part of this effort comes from our hospital partners like St. Agnes, who have worked tirelessly to support our residents during this time, especially as we continue our efforts to efficiently and equitably distribute the vaccine. Ascension St. Agnes is one of the first hospitals to come forward and offer their services in partnership with the city to vaccinate our older adults in Southwest Baltimore and our first responders. I want to turn it over to Dr. DeRosa and Mr. Laverne to speak more on this partnership. Dr. DeRosa.
Good afternoon, and thank you, Mayor Scott, for your continued leadership during this pandemic. I'd like to briefly share the data on our key COVID-19 metrics here in Baltimore City. As of yesterday, as Mayor Scott mentioned, we have lost 782 lives to COVID-19. We have had a total of 39,820 cases here in Baltimore City, and our latest 7-day average is 89 new cases per day, a more than 60% decrease from where we were 4 weeks ago, and our lowest average since before Halloween of 2020. Our latest 7-day average positivity is 2.2%, a decrease of 58% from 4 weeks ago. Our hospital utilization rates have also decreased, with both the ICU and acute care units at 83% capacity. Fatalities due to COVID-19 are now averaging slightly less than 3 deaths per day. Today, I am pleased to announce that the Baltimore City Health Department and our healthcare partners have reached 10% of the city's population with at least 1 dose of the vaccine. As of today, the Health Department has provided 8,107 first doses and 5,081 second doses for a total of 13,188 doses. In total, 59,155 Baltimore City residents have received their first dose, and 29,751 have received their second dose of vaccine. The COVID-19 vaccination rollout has been an all-hands-on-deck effort, and later I look forward to introducing Ascension St. Agnes CEO Ed Laverne to speak about the efforts to vaccinate our older adults and first responders. Despite the positive news and important milestone, vaccines remain in short supply both in Baltimore and nationally. As was reported last week, inclement weather affected Maryland's vaccine supply chain, limiting the number of doses our state received from the federal government. Locally, this meant that the Baltimore City Health Department did not receive any additional doses of the COVID-19 vaccine last week due to the weather challenges. We are pleased to announce that a shipment came this morning. However, we have been advised that additional shipments can be expected to be delayed this week. Knowing this, I'm asking for patience from Baltimore City residents as we work through these logistical challenges. At this time, vaccine supply remains our greatest limiting factor in providing more vaccinations to residents. However, there are steps that eligible residents can take now to ensure that once more vaccines are available, they are well positioned to receive one. As a reminder, at this time, all vaccines are by appointment only in Baltimore, and eligible Baltimore residents in priority groups 1A, 1B, and 1C are encouraged to visit coronavirus.maryland.gov to sign up with local hospital partners, clinics, and pharmacies and fill out their interest forms. Baltimore residents who are age 65 and older can go to our website, coronavirus.baltimorecity.gov/COVAX, COVAX, or call our MAP hotline at 410-396-2273 to register their interest in receiving a vaccine. At this time, over 20,000 Baltimore older adults have indicated their interest in receiving their vaccine through our MAP interest form, and our team is working to set up appointments with area healthcare providers as vaccinations become available to ensure that our older adults continue to be prioritized. Additionally, working with partners, our mobile vaccination clinics have begun pre-registering and vaccinating older adults for whom transportation to and from mass vaccination sites may be a barrier, bringing vaccines directly to independent living facilities around Baltimore. Operators of those independent living facilities have received emailed instructions on how to request a mobile vaccination clinic to come to their location, and the interest form is also available on our website. Contact tracing remains as important as ever in quickly identifying disease transmission, and we still need residents to pick up the phone when MD COVID calls. Additionally, while we have spent a great deal of time discussing the COVID-19 vaccine, testing for COVID remains a vital component of our overall pandemic response, and we still encourage residents, if they are experiencing symptoms suggestive of COVID or have been in close contact with someone with symptoms suggestive of COVID, to go get tested. Our mobile testing clinic schedule is posted on our social media accounts and on our website, coronavirus.baltimorecity.gov/testing. Finally, newly relaxed COVID-19 restrictions went into effect this morning. We are grateful to the city residents who have heeded the advice of public health professionals, have taken social distancing precautions seriously, and have been wearing their face coverings. As a reminder, with today's easing of certain restrictions, residents should continue to adhere to COVID-19 best practices so that our data continues to trend in the right direction. Washing your hands, wearing a well-fitted, multi-layered face mask, securely covering your nose and your mouth, and keeping at least 6 feet of distance from others not in your household helps to limit the spread of COVID-19. With your help and continued following of these guidelines, we should continue to see progress in our restrictions as our vaccination rates increase. For questions related to the executive order, please visit coronavirus.baltimorecity.gov/executive orders. Now I'd like to introduce Ascension St. Agnes President and CEO Ed Laverne to talk about the critical role St. Agnes has played in vaccinating hundreds of eligible first responders. Thank you.
Thank you, Mayor Scott, Commissioner Gerasa, Commissioner Harrison, Chief Ford, for inviting Ascension St. Agnes here today and for your partnership in this important work. From the moment COVID-19 emerged in the United States, dedicated caregivers across Maryland have been remarkable in their response. And I'm so grateful to all of our Ascension St. Agnes nurses, doctors, and staff for their commitment that they've shown over the past year. As the pandemic continues to affect people worldwide, the promise of a safe and effective vaccine is critical to stopping the spread. As we prepared to begin the vaccination process, Ascension looked closely at how best to justly, ethically, and equitably distribute COVID-19 vaccines. Following early successes in the initial phase of vaccinations for our frontline caregivers, Ascension St. Agnes offered our support to the Baltimore City Department of Health to extend vaccinations to other important eligible groups according to state and federal guidelines. We are very happy to be in a position to administer COVID-19 vaccines to first responders in Baltimore City who are essential partners in keeping the community safe and healthy. We are also working with the Health Department's Division of Aging to vaccinate a limited number of seniors who are supported through its aging services. Ascension St. Agnes began partnering with Baltimore City Health Department to extend vaccinations to first responders in Baltimore City on January 6th. We have gone on to vaccinate more than 1,600 members of the Baltimore Police Department and other first responders as of February 19th. We have vaccinated 200 seniors through the Division of Aging, with another 500 scheduled this week. We believe the COVID-19 vaccines are both safe and effective, and the benefits of being vaccinated outweigh any identified risks or side effects. I want to strongly encourage everyone, especially first responders, to get the COVID-19 vaccine when it is made available to you. COVID-19 vaccination is a very important measure to reduce transmission in our community. The COVID-19 vaccine has also been associated with a very high efficacy. Studies showed that if 100 people take the COVID-19 vaccine, 95 people will benefit from taking it and will be protected from the infection. This is an excellent response compared to other vaccines. The benefit of the COVID-19 vaccine is to provide protection to those that receive it and to create a majority of the population that is immune so we can prevent transmission of infection between people. It will take time to vaccinate all of the members of our community. In the meantime, it is very important to continue all the practices that we have put into place over the past 11 months, such as wearing masks, practicing social distancing, and practicing safe hand hygiene. And in closing, please remember not to delay if you have an urgent health care need. Our hospitals and emergency rooms are well prepared to safely care for you. Thank you very much.
Thank you, and thank you, Mr. Laverne Etz. Mayor, I deeply thank you. We appreciate the partnership and are grateful to have your support as the city continues to move through our vaccination strategy. And we know that although many of our residents have expressed interest in getting vaccinated, hesitancy still exists within our community. And I want to invite Commissioner Harrison and Chief Ford, both who have been vaccinated as first responders, to speak to their experiences and the status of vaccination within their ranks.
Good afternoon, and thank you, Mr. Mayor and Commissioner Juraza. As of this morning, over 1,350 members of our department have received their first dose of the COVID-19 vaccine. This equates to over 45% of the department, to include sworn and civilian members being vaccinated. And as we are still working to get more members scheduled for the first and second dose, this would not have been possible without the help of the Health Department and our partners at Ascension St. Agnes Hospital, Baltimore City Community College, and the former vaccination site under the Under Armour facility. Starting in early January, Ascension St. Agnes Hospital worked closely with our COVID-19 task force and offered space in their clinic to vaccinate our first responders. I want to thank Lieutenant Slimmer, our infectious control officer, and the members of the task force that have worked in coordination in coordinating the vaccination of almost half of the department so far. They also assisted me in getting my vaccine. In January, I received my first vaccination and then received the second one earlier this month. It was important for me to get vaccinated, not only to stop the spread of COVID-19, but also to encourage others to get vaccinated when they're eligible. Some of you may know that my own son tested positive for COVID-19 in March of 2020, and while he made a full recovery, he had some extremely tough symptoms of the virus. So it was important for me to get the vaccine and to encourage others within my department and even my own family members when they're eligible, to do so for the safety and for the safety of others. I, for one, am looking forward to visiting my brand new granddaughter without putting her at risk and my other family members at risk. So I encourage everyone, when you're eligible, to please get the vaccine. The health and safety of our city depends on us following COVID-19 restrictions, practicing social distancing, and the residents signing up to get vaccinated. Again, I want to thank all those who have worked in vaccinating our first responders and helping to move our city forward. At this time, I'll turn it over to Fire Chief Niles Ford.
Good afternoon, everyone. Thank you, Mayor Scott, for your leadership, and thank you, Dr. Jaraza, for being a champion in the fight to help our community stop the spread of COVID-19. And thank you, Commissioner Harrison, for sharing your story. I also want to thank the members of Baltimore City Fire Department for continuing their progressive steps to ensure the safety of our community. I made the decision to receive the COVID-19 vaccine because I believed it is the gateway to ending this pandemic. This vaccine will save many lives. And in May 2020, I tested positive for COVID-19. Fortunately, I was able to recover from this virus while taking the necessary precautions to protect myself and others. That is why I'm a strong support of COVID-19 vaccine and a champion for the protection of our members and this community. It's because of our partnership with Under Armour, Baltimore City Community College, Maryland Institute of Emergency Medical Services, and St. Agnes that we are able to administer this life-saving, to administer this lifesaver, not just to first responders, but the entire community. On January 4th, I received my first vaccine, and on February 4th, I received my second part of the vaccination. And I will continue to encourage members to receive the vaccine and continue wearing their masks and practicing social distancing. As Commissioner Harrison stated, I'm also ready to resume visiting my family, visiting my friends, and even visiting the fire stations without putting them at risk. Mr. Mayor.
Thank you. Thank you both, and thank you for your work, and thank you for your leadership and being a part of the fight by getting vaccinated. Now we'll take questions. First.
I'll build up in that walk. Mr. Mayor, with M&T Bank coming on as a mass vaccination site later this week and having the convention center, has the state given any nod in any way, any set-aside designated doses for Baltimore City? Because I know when Six Flags opened, at least on day one initially, they had a couple of hundred set aside just for people in Montgomery County. Is there any benefit the city is getting out of those mass sites?
So I'm going to bring the Health Commissioner up, but as you may know, we particularly asked, we had at that time 15,000 seniors that we asked for the state to prioritize at the mass vac site at the PCC. That request, to my knowledge, Dr. Duraza, was never met. We do believe, and I will say again, that at least half, you would think, to have at least half of by my opinion, half of the sites, the doses that are given at those sites should go to the folks in the jurisdiction, but we know that it's not the case as of yet. We're going to continue to work and push with the state to see if we can get those things happening. Dr. Jaraza?
No, Mayor Scott stated it perfectly. We would love for 50% of those slots to go to city residents. We recognize the high need. We recognize a highly vulnerable population and already have a list of 20,000 older adults who are eligible in need of the vaccine. So that would be ideal, but no, we have not received a response yet.
My other question, obviously we're all aware of variants and the potential for that they pose as far as other outbreaks, but just with the timeline of getting people vaccinated and the unsureness surrounding how long that protection lasts, have you been planning or kind of looking ahead, realizing that there's some potential, or is there potential that we may be revaccinating people before we even get done vaccinating everyone? I mean, is that possibly something we'll all have to live with?
Dr. Duraza, we'll let the medical professionals answer that question.
Thank you.
Yeah, so I mean, again, there's not enough information to know yet. We look to the CDC for guidance, and I know that's one of the main things they're investigating is how long does this immunity last? For instance, we know with the flu shot that annually you get a new flu shot. So it's not certain yet, but that's certainly a possibility that this could become an annual shot.
One last question, Mr. Mayor, for those out there wondering, when, say, the restaurants would be able to expand a little bit more with inside dining, et cetera, I know you look at the science and your health experts daily, but
Hourly.
hourly, minute by minute. But is there any particular targets, less than 3% positivity, anything at all that people can look ahead towards?
It's
where
the
you feel
same.
comfortable?
It's the same as that I said before. It's not one metric versus another. We're looking at a combination of all the things, and we're going to do this time just like we did the last time, right? We're going to look at the data over the next 4 weeks, and as you saw, we saw significant improvement, and when we saw significant improvement, we relaxed restrictions in a significant manner. That is not an opportunity for folks to be reckless. We still want folks to take this very seriously, but we will do it in due time and do it in a respectful manner according to the science, and understanding that we want to continue to be leading the state by having the lowest positivity rate. Anybody else? Alexa?
Good afternoon. Over the weekend, Councilman Ryan Dorsey tweeted about a drug seizure triggering backlash from Baltimore police and the FOP. Did his words impact the unified front you are seeking, and do you plan to address it?
Councilman Dorsey, his remarks are from Councilman Dorsey. He'll be the first to tell you that. I did have the opportunity to speak with both the councilman and with the FOP president over the weekend. And what I'll say to you about those conversations, Alexa, sometimes men have to talk as men, and what is said there remains in between those individuals. But what I want folks to understand, with all the critical things that we have going on here, from the violent crime fight that we're continuing to need to focus on in Baltimore, to the reform efforts that are going on, we have to all understand that we have to work together to move this city forward. No one can be painted broadly one way or the other, and that's where the focus is going to continue to be.
May I ask Commissioner Harrison?
Sure.
I know you issued a letter to your officers as well as said that you had a conversation with Councilman Dorsey. What do you want the people to know?
Well, number one, I personally called the councilman and spoke to him about how I felt about what he said. And he acknowledged that that was the right thing to do for me to call him. And I invited him to always call me if there are any issues with the department as a whole or a particular member or members of the department. That's number one. Then I talked about painting everybody with a broad brush. And I want to talk about the good work that the men and women of the department are doing every day to help make Baltimore a safer city. And I want to talk about how we should have unifying messaging, not dividing messaging, to make us come together so we can all work together. Because we're on the same team, we should be on the same page to make Baltimore a safer city.
Thank you.
Thank you.
Hi, Mayor. I just wanted to ask you about reluctancy when it comes to the vaccine and getting the vaccine. There was a national story yesterday on CBS this morning talking about just that. It featured Baltimore and the maybe younger people who don't want it. What more is your office doing to encourage people to get the vaccine to stop the spread of the pandemic?
Yeah, I think you know that we're going to continue with the robust ways to trying to reach people where they are. We announced last week the partnership with Micah and Morgan. You're going to see more from us using credible messengers in our community, using social media in the innovative way that myself, the health department, and our agencies are able to do. We're going to do everything in our power to get people to understand why they need to take this vaccine. But I think it's very critical for folks to understand that this hesitancy isn't something that people just develop out of thin air. They're talking about Baltimore City. We're talking about the United States of America, where time and time again, medicine, right? Medicine, the testing of medicine, the testing of anything in the health field has been basically used African Americans in this country as guinea pigs. We have to go into that conversation understanding that that is fact, and that you're going to have to use credible messengers. Talk about the fact that there was a black doctor who went to UMBC that was involved in the development of this. Talk about how these trials are different than the ones in the past, and have people understand that this time is not what happened before, but never go into that conversation without that cultural understanding. Thank you, everybody.